you're dealing with pain right in the front of your pelvis during your pregnancy, this is for you. Hi, I'm Kayla. I'm a pelvic floor physical therapist who works with women who are pregnant and postpartum every day. This front part of our pelvis is called our pubic symphysis joint. It's where both sides of our pelvis come and meet. Typically, we don't have a lot of movement in this joint. When we're not pregnant, it's about 2 to 3 millimeters. But when we're pregnant, we have elevated levels of a hormone called relaxin, which causes extra movement throughout our body. So this joint all of a sudden can move a little bit more than it typically does, which can be so painful. It can create those really sharp, uncomfortable pains in the front of your pelvis or more off to the side in your groin. There's a lot that you can do to help minimize the discomfort in this area and make it so your day-to-day activities feel so much better. The biggest thing that tends to aggravate this pain is asymmetrical movements. So whenever we have all of our weight on one side of our body or one leg, that creates a shearing force through this joint, which can be so uncomfortable. So trying to limit the amount of asymmetrical things that we're doing throughout the day can be really helpful. When you're putting on your socks and your shoes, try sitting down to do that. If you're just standing, try to have equal weight through both of your legs. Don't just shift all onto one leg or the other leg. Going up and down stairs, sometimes doing it sideways is actually more comfortable than going straight up and down. So those are a couple little tips and tricks that you can use just in your day-to-day life. If we're thinking about exercises that help create more stability at this joint, we can try some isometric activation of our hip muscles to create more stability in the joint, which should help it feel a little bit better. So when you're standing, you can have your feet hips distance apart. Pretend like you're pulling the floor apart without actually moving your feet. You should feel your outer butt muscles activate when you do that. If that feels okay and doesn't create any extra pain, you can try sitting down into a little bit of a squat and coming back up, all while you keep pushing your feet out to the side. You should mostly just feel your outer hips, but that muscle activation should create extra stability for your pubic symphysis joint, take stress off of that area, and make things like walking and getting in and out of bed so much more comfortable.